Welcome everybody to Empowering Seniors, the virtual event this year. Okay. As the lead sponsor, Care has asked me to come in and talk a little bit about Medicare, some of the changes, some of the expansions, and some of the lower costs that may be coming about that you'll see this year. So first of all, let's kind of talk about when to sign up for Medicare. Okay. You have a 7-month enrollment period when you turn age 65 for sign up for Medicare. So it's 3 months before you turn 65, the month you turn 65, and 3 months after 65. Those are your 7-month enrollment period to sign up for Medicare. Now, what does that mean? When should I really sign up? It really depends on when you want your Medicare coverage to begin. Let's say my 65th birthday is in April. If I sign up in January, February, or March, my Medicare benefits will begin April the 1st. If I sign up in April, my Medicare benefits will begin on May 1st. If I use the 3 months after I turn 65, there's going to be a little bit of delay in my Medicare beginning. It depends on when I want my Medicare to begin. If I sign up in May, the month after I turn 65, my Medicare benefits will begin in July. If I sign up in, it depends on when you want your Medicare benefits to begin. If I sign up in May, the month after I turn 65, my Medicare benefits will begin in June. However, if I sign up in June, my Medicare benefits won't begin until August. If I sign up in July, my Medicare benefits will begin in September. So there is a delay in when your benefits begin if you wait till the 3 months after you turn 65. So again, if I want my Medicare benefits to begin the month I turn 65, I want to sign up the 3 months beforehand. Again, so if my birthday is in April, I want to sign up in January, February, or March for an April 1st start date for Medicare. And that doesn't matter when in the month of April my birthday is. If my birthday is on April the 15th, my Medicare begins on April the 1st. The only time this is different is if you're born on the first day of the month. So if I was born on April the 1st, I would sign up for Medicare in December, January, or February, and my Medicare would begin on March the 1st, the actual month before I turned 65. So the first day of the month has a little bit of difference with the normal rules. So again, it depends on when you want to have your Medicare begin. Let's say I've turned 65, Tom, but I'm still working. So I have group coverage, okay? If you have group coverage, you actually do not need to sign up for Medicare technically at all. Now, there's different parts of Medicare, and you're going to hear me talk about parts. Anytime I say a part, that means it's part of the government insurance. So there's Part A, Part B, Part D, and we'll talk about Part C. So Part A covers our facility costs. Most times that's going to be your hospital. Part A comes with no additional premium. I never say it's free because Part A is paid for by payroll taxes. So we're paying every dollar we earn, we pay 1.45% payroll tax on that. And there is no cap on that. And if our employers match that with another 1.45%. If you're lucky enough to be self-employed, you get to pay the full 2.9%. So Part A is not free. It just comes at no additional premium because we've been paying for it during our working years. So Part A covers our facility-based coverages. If I have group coverage, I can go ahead and add Part A. It'll be my secondary coverage to help with facility costs. The only time you would not really want to add Part A if you're covered by group plans is if you have a high deductible health insurance plan. If I have a high deductible health insurance plan and I'm able to participate in a health savings account, an HSA account, these account money are coming pre-tax out of my paycheck, and those monies can be used for any medical expenses tax-free down the road. If I sign up for Medicare Part A and I'm eligible for an HSA account, at that point, I'm no longer eligible to contribute because Part A is not considered to be a high deductible plan. So I'm turning 65, I'm still working. I'll sign up for Part A if I do not have an HSA account. If I do have an HSA account and my employer allows me to do so, I'll delay signing up for Medicare Part A. Once I retire, once I leave my group coverage, at that point, I technically will have 8 months to sign up for Medicare Part B. Medicare Part B comes with additional premium. The premium is based on income, but not income that you're earning this year. It's income that you earned 2 years ago. See, Uncle Sam doesn't know how much money you make right now. So he knows how much you filed taxes on 2 years ago. So let's use the year 2021. So if I'm going to start my Medicare Part B in the year 2021, he looks at what was my adjustable gross income in the year 2019. If my adjusted income in 2019 was less than $174,000 as a married couple, then I'll pay the base rate. If my income as single was less than $87,000, I'll pay the base rate. Okay. Currently, the base rate is $144.60. It is projected to go up to possibly $100, and they really don't know. They'll make that announcement here in a couple of weeks, but we're projected to be somewhere around $148. We'll have to wait and see. Okay. It's all based on income. The higher our income is, the higher the Medicare Part B premium will become. Part B is technically deemed to be an optional coverage. It's optional because the government can't make you buy something. Okay, it's optional. However, they do want you to have physician-based coverage. They do want you to have physician-based coverage. So Part A covers our facility base, comes with no additional premium. That covers our hospital costs, but not quite all the hospital costs. You're going to have deductibles and daily co-pays if you stay in the hospital for more than 60 days at a time. It also covers our skilled nursing facility. First 20 days of skilled nursing is no charge. After that, from days 21 to 100, there's a daily fee. Now, the skilled nursing in Medicare is not custodial nursing home. This is really deemed as rehabilitation services. You go get your knee replaced, it's the rehabilitation. Get your hip replaced, it's rehabilitation. Now, the good news is the average stay in a skilled nursing facility is only 14 days. But if you should have a stroke or if you should need to go into a rehabilitation center for longer, you do have 100 days total for Medicare paying it. The first days 1 through 20 will be zero cost. Days 21 through 100 will be at an extra fee. Medicare Part A also covers your home health care. Now, it's facility-based. You're providing the facility, so therefore there'll be no cost for you, no charge for using your home. It's also going to cover hospice care. Hospice care says you're terminal, you have less than 6 months to live. Okay? The hospice care is going to treat you at the house, or at the worst case, you could go into a hospice facility. In that case, you're looking at the max be 5% of the facility cost. Now, just because they say you have 6 months left to live doesn't mean you're time-stamped. Okay? If you're still alive after the 6 months, you get an automatic 45-day extension. Still alive after that, you get continuous 60-day extension until a miracle happens and you get well again. Because remember, they're not treating the illness at this point. Or until you do pass. Most folks, when they're on hospice, pass within the first 6 months. It's all about comfort care. Now, the nice thing about this is comfort care for the patients, but it's also comfort care for your family members. Once you pass away, if they need counseling, they have up to 1 year where they get free counseling services. The last part of the facility care is your psychiatric hospital. You have a total of 190 days covered in psychiatric hospital, and it's billed the same way regular hospital is, where you have a 60-day deductible, and then you have daily copays. So that's your Medicare Part A. That's where we're funding with our payroll tax. Medicare Part B is a physician-based care. That's where you're going to have the monthly premium. Again, this year in 2020, it is $144.60, projected to go up to right around $148.60. By the time you see this in January and February, you'll know exactly what that amount is. Okay, so that'd be the monthly premium, and then after the monthly premium, you'll have an annual deductible. Unlike the deductibles and co-pays with Medicare Part A, the Part B is a one-time annual deductible. Here in 2020, it's $198. I've seen projections for being around $205, but we don't know what that number is going to be until 3 or 4 weeks from now. It's funny, the government, we're going to be doing Medicare planning right now in what's called open enrollment from October 15th to December 7th. People get to change and evaluate their Medicare plans. But the government doesn't actually tell out how much Medicare costs are going to be until the last week of October, first week of November. So it's kind of strange we're talking about what these costs are going to be and we don't know what they're going to be yet. The main reason the government feels like they can do that is these costs only really apply to people who have Medicare only. If you pick up some other type of coverage, such as a Medicare supplement plan or Medicare Advantage plans, the daily copay amounts really don't mean anything to you. Most times the annual deductible for Part B isn't going to mean anything to you. That's why the government feels like they don't have to announce what these costs are going to be, and they can have people start evaluating their Medicare coverages before they make those announcements. So we have Part A is our facility cost. Part B is our physician-based cost, outpatient surgery, ambulances, and are included in that. And then we have Medicare Part D. Part D is prescription drugs. Now, they added Part D back in 2006. They started working on it in 2003, and everybody got real excited when they said, hey, we're going to have prescription drug costs. When they rolled it out, people kind of went, There's 4 phases to the drug plan. Okay, the first phase is the deductible. Okay, currently here in 2020, that is $435. So the first $435 in 2020 is on you. I believe it's going to be $455 for 2020. Once you do the first phase of deductible, then you go into phase 2, and phase 2 is the cost sharing. Here's when the cost share is going to be 75% with Medicare, 25% with you. Once Medicare's billing has reached $4,130 in the year 2021, not what you pay, but what Medicare billing is, then you're going to enter phase 3, which is known as the coverage gap. Coverage gap has affectionately been called the donut hole. Here you're going to find your costs are going to go up. Now, Congress went ahead and they closed the donut hole, except what it means is that you're still going to pay 25% for your name brand and your generic costs of drug medicines when you're in this coverage gap, when you're in the coverage gap. So how do we get there and what is the difference? I go to CVS and I pay $3 for my prescription. CVS bills Medicare $24. I go to Walmart, pay $3 for my prescription. Walmart bills Medicare $40. I go to Costco, pay $3. Medicare goes ahead and bills. Okay, so your costs for your prescriptions are going to be right around $3 if you're in one of the lower cost plans. But the pharmacies bill Medicare, and it's when Medicare's billing reaches that $4,130, that's what gets you into that coverage gap. So if you take a lot of specialty drugs, if you're using a compound pharmacy, our recommendation to you is use the compound pharmacist for that compound drug, but use a different pharmacy for your other maintenance drugs. Because there really is no regulation on what the prescriptions, what the drugstores can charge, the pharmacies can charge Medicare, and there's definitely no restrictions on what the manufacturers can charge for their prescription drugs. So to help keep you out of the coverage gap, okay, we want to make sure that you take most of your maintenance drugs, use a regular pharmacy, or ask the pharmacy you're doing, if they're independent, how much are they charging Medicare for these drugs? Because you want to try to stay out of that coverage gap if you can. And the reason is this year the coverage gap is going to be a little bit longer. So once you find yourself in the coverage gap, you're paying 25% of the manufacturer's price minus any discount they're giving. But you'll be in the coverage gap until you have spent $6,550. So in 2021, you're going to find yourself in that coverage gap longer before your prescription drugs go down in cost. Once you've completed that, this is money you spend out of your pocket. Then you go in the 4th phase, which is a catastrophic phase. Now your drug costs will drop down to under $9 for name brand and under $4 for generic. And if you're in a specialty drug, you'll pay 5% for any type of specialty drug that you take. Okay? I take a specialty drug called Cosentex. Not all drugs are treated the same. I have psoriatic arthritis, the same disease that Phil Mickelson has. The problem is that disease doesn't come with Phil's golf shot. So when I go to the pharmacy, okay, it's a little bit expensive. My drug costs $4,900. Okay? So these plans have what they call a step therapy system in here. All of the plans must offer a medicine that covers whatever your illness is, but they don't have to necessarily cover the drug that you take. There are three main drugs you see advertised an awful lot for my disease. One is Enbrel. That's the one that Phil takes. It's about $2,600. Then you've got Humira. That one's $3,800. And Cosentex, the drug that I take, is $4,900. Now, the drug companies must cover one of these, the health plans must cover one of those drugs. So which one do you think they want to cover? That's right, they'll cover the $2,600 drug. The problem is that drug doesn't work for me. So in the normal circumstances, they're going to want me to be on that lower cost drug for 6 months. Then if it doesn't work, then I can apply to get another medication. However, since my doctor knows that drug doesn't work for me, we can apply for a medical exception immediately and try to get the medicines that it does cover for me. If you're ever looking for an exception on a drug, and if it's a life-threatening drug, those decisions are made within 24 hours. A drug like what I take, it may be 72 hours, which is 3 business days to get that approved. But the bottom line is, even though we're trying to save you money, you are going to get the medications that you need in most cases. Okay? There are different levels of drug coverage. There's they call them tiers. There are 5 standard tiers. Tier 1 is your preferred generic. Tier 2 is your regular generic. Tier 3 is your name brand. Tier 4 is your non-preferred name brand. And Tier 5, those are the specialty drugs. And when you get to Tier 5, the spelling really needs to be changed to TEAR, because that's where it gets a little painful out there. Okay. So that's your drug coverage. So you have Medicare Part A's facility. Part B is your doctor. Part D is your drugs. Part B and D are considered to be optional coverages because those are going to cost you money. If I'm still working and covered under an employer plan, I do not need to sign up for Medicare Part B or Part D until I lose my coverage, until I leave my company, until I retire. If you have, now one thing too, if you have coverage from the VA, Medicare, either whether it be VA benefits, CHAMP VA, TRICARE for Life. If you're covered by VA, okay, you do not need to sign up for Medicare Part D, the prescription drug coverage. You can if you want to. They're now working in coordination with those. However, you will need to sign up for Medicare Part B. This has kind of been confusing on here. VA coverage is considered credible for prescription drugs. It is not considered to be credible coverage for physicians. And what that means to you is that if I've been getting my benefits from the VA, I go to see the VA doctor. I'm 65. If I wait 2 or 3 years later and then sign up for Medicare Part B, I will be faced with a penalty. They don't look at VA coverage as being credible for VAs. Okay. So what happens is that the penalties for Medicare Part B, if you don't sign up in time, is an extra 10% surcharge each month for the rest of your life. So let's use today here in 2020. Right now, it's $144.60 a month. If you went 1 year past the time you're supposed to sign up for Medicare Part B, you have a $14.40 penalty. If you go 2 years, it's $29 penalty. And that $29 penalty for not signing up for 2 years that you should have had adds on to your Medicare Part B every month for the rest of your life. The third part of Medicare is Medicare Part D. Part D was added in 2006. Part D covers our prescription drug coverage. So Part A is our facility-based coverage. Part B is your doctor-based coverage. That is original Medicare, Medicare A and B. Now we add the Part D, the prescription drug coverage, in 2006. When they rolled out the drug coverage, this was put together a little bit differently. There are 4 phases to the drug coverage. Phase 1 is the deductible. For 2021, that annual deductible is going to be $445. Once you've paid $445, at that point you'll move into the second phase, which is a cost-sharing phase, 75%, 25%. So roughly 75% will be covered by Medicare, 25% will be covered by you. When you go to the pharmacy and you pay your $3 for your prescription drug and they bill Medicare $38. You go and pay $5 for your drug and they go ahead and bill Medicare $60. When all those Medicare billings reaches a little over $4,100, okay, at that point you're going to enter into the third phase, which is known as the coverage gap, okay, affectionately known as the donut hole. And the reason they call it that is because now you're going to find that your Medicare costs for your prescription drugs are going to go up. Because now you're still going to pay the 25%. So it sounds like the same, except now it's off of the manufacturer's price, minus any discounts the manufacturers are giving. Which means for your name brand drugs, you're going to see a cost increase here for your medications. Okay? When you have paid out of your pocket $6,550, then you're going to move into the catastrophic phase, and that's where you're going to see your drug costs go down significantly. Your name brand drugs will drop below $9. Your generic drugs will drop below $4. Any specialty drug you take will be at 5%. So to recap, the 4 phases, the first one's the deductible, okay, and that's $445. The second one is the cost sharing. And again, when you go from cost sharing to the coverage gap, it's not actual dollars you've spent, it's the dollars that Medicare has been billed. So when Medicare receives their billing, okay, and that reaches over the $4,350, at that point, that's when you enter into the coverage gap. Okay? And now you're looking at your dollar cost, which means it's real important when you're going to the pharmacy, if you ever take a compound drug. So that means you need to go to a compounded pharmacy, because the regular pharmacies usually don't do compounded prescriptions. Get your compounded drug at that particular pharmacy, but you need to take your maintenance drugs. You need to go to typically a regular pharmacy for those. Or ask your compound pharmacy that you're going to, well, how much do you bill Medicare for your standard drugs, your maintenance drugs? Because it all depends on what Medicare gets billed, how quickly you get into the coverage gap. See, there really is no regulation on how much the drug manufacturers charge for their medicines or how much the pharmacy charges for theirs either. So when you're looking and you have to take a compounded drug, so if I'm taking a compounded drug, I really need to do some competitive shopping here. I need to find out what is being billed to Medicare, because that's going to impact how quickly I get into that coverage gap. And this year the coverage gap is $6,550, which means I'm going to be in there longer than in other years before I get to the catastrophic phase, before my costs end up going down. Not all drugs are treated the same. There are 5 basic tiers in the prescription drugs. Tier 1 is your regular preferred generic drugs. Tier 2 is a regular generic. Tier 3 is your preferred name brand. Tier 4 is your non-preferred name brand. And Tier 5 is your specialty drugs. Okay? So you have different levels of tiers on your medication. Okay? All of the drug plans must offer coverage for every disease out there. However, they don't have to offer all the medicines for those diseases and illnesses. For instance, I've got psoriatic arthritis. One of the drugs that treats this is around $2,600. Another drug that treats this illness is $3,800. The drug I take is $4,900. So there's quite a bit of difference there, $2,600, $3,800, and $4,900. They must offer me a drug to cover my illness. Now, which one of those 3 do you think they're going to want to offer me? That's right. They're going to do the $2,600 because they have to. The problem with that $2,600 drug is it doesn't help me. My body doesn't react well to that. So there's something called step therapy. They want you to be on the lower cost medicine for 6 months to see if that's going to work for you. Because again, they're trying to save money. And after 6 months, if that medicine doesn't work, then they'll evaluate to move you to one of those other drug alternatives. However, if your doctor knows that that drug's not going to help you, you can apply immediately for a medical exception. If it's a life-threatening decision, that decision is made within 24 hours. If it's a drug like what I take, for arthritis, that may take 72 business hours, 3 business days, to go ahead and decide if we'll go ahead and get onto that proof. But the bottom line is we want to get you the medication you need to have you feel better, but they're going to want to initially see if you can do those lower cost drugs. But the bottom line is if your doctor knows those drugs aren't going to help you, let's get the exception and we can help you get the drugs and medications that you need. Because it's important to make sure you're maintaining that quality of life out there. So even though they're trying to save money, they still want you to be able to have good coverage. Now there's also quantity limits on some drugs. You're not going to be able to get 500 hydrocodone in a single month. Now unless your doctor says you need that. In that case, then the FDA will probably look at your doctor to see what kind of illness and stuff that you have. And there's also prior authorizations required. So that's Medicare Part D. So Part A is our facility-based, comes with no additional premium because we funded it with payroll tax. Part B you must enroll into and comes with a monthly premium. Part D also comes with a monthly premium. Both B and D are deemed to be optional coverages. Again, if you have group coverage through your employment or through a spouse's employment, you do not have to enroll in Medicare Part B or Part D. Once you lose your group coverages, though, at that point you are required to have Part B and Part D coverages. Gets a little crazy here. Once you leave your group plan, technically you have 8 months to sign up for Medicare Part B before you're in a penalty situation. You have 63 days to sign up for Part D before you're in a penalty situation. So the bottom line, the best thing is get into Part B and Part D immediately upon leaving your group coverage, because you get 8 months over here and 63 days there. Gets kind of crazy. And the bottom line is, if you ever are subject to a Medicare penalty, it's brutal because the government penalizes you every month for the rest of your life. It's not a one-time penalty. It's a monthly penalty that adds every single month for the rest of your life. Kind of crazy. Let's say I have VA coverage, Champ VA coverage. I have TRICARE for life. I also need to make sure I've signed up for Medicare Part B. So the VA stuff's going to cover my medicines. That's fine. It is deemed to be credible coverage for Part D. At any time, if you decide to roll into a Part D, you will not be subject to a penalty because you had credible coverage because you had VA benefits. However, it is not deemed credible for medical. So you need to sign up for Part B when you first turn 65, or if you were covered from group insurance, you left the group, but you say, well, I got VA, I'll be okay. You're not okay. You must sign up for Medicare Part B. Otherwise, you'll be subject to those penalties. So I urge you, if you have VA coverage, make sure you pick up Medicare Part B, because there's been some miscommunication out there if I have to have it or not. You must get Medicare Part B, otherwise you're going to be penalized. There is no exception for VA coverage on that. So as you see, there's Medicare Part A, again facility, Part B is doctor, Part D is prescription drugs, and Medicare doesn't cover everything. Okay? Once you sign up for Medicare, here's a copy of what your new card's going to look like. Okay? You should have your Medicare card within 16 days after enrolling into Medicare. You'll notice on the card it does not have your Social Security number any longer and will no longer have your sex on the card. There are certain names like Ryan that can be associated with both male and female. So they've taken the sex off of your cards and they no longer have your Social Security number on there, all designed to help protect your identity so someone can't steal your identity. So feel free to have your Medicare card in your wallet. It's an 11-number character card number that has no either astrological connection to your identification at all. So how do we cover all this stuff that Medicare doesn't cover? Here's kind of a slide here I put up here, showed that Medicare A and B is original Medicare. So what are my alternatives? I can go to buy a Medicare supplement plan. These are insurance plans sold by individual insurance companies. There are 14 of them out there, A through N. Not all of them are currently offered. The most comprehensive coverage right now is offered by Plan G. It has a monthly premium on it on top of what your Part B would be. And with that plan, it would cover everything except for really the Part B annual deductible. However, when the government came out with a prescription drug plan coverage in 2006, they told the supplement plans they are no longer allowed to have drug coverage in them. So that means you would also have to sign up and buy a Medicare Part D card, a Part D prescription plan. So that's one way. You can go ahead and buy a supplement plan and then also buy a drug coverage. The other alternative is you go into Medicare Part C. Remember, I said part again because it is part of the government plan. So Part C is going to have Part A in it, plus Part B, plus Part D equals Part C. And Part C is known as the Advantage Plan. So the Advantage Plan here, this is going to offer you things that Medicare doesn't cover. Medicare doesn't cover things like your eyes, your ears, or your teeth. Because after all, nothing ever goes wrong with our eyes, ears, and our teeth when we get older. The other alternative, as opposed to buying a Medicare supplement plan and buying a prescription drug plan, is to enroll into Medicare Part C. Remember, I said part because that means it's now part of the Medicare system. Part A is your facility, Part B is your doctor, Part D is your prescription drugs. All of these parts will be rolled in together into Medicare Part C, known as the Advantage Plan. When you enroll into the Advantage Plan, now you're going to get your Medicare benefits provided by whichever carrier that you enrolled into their Medicare Part C plan. So there's lots of carriers here in the Metroplex that offer Medicare Advantage plans. When we're looking at the Medicare Advantage plan that's best for us, we need to kind of look to see, are our doctors covered? Are our prescriptions covered? What type of other products, other services do they offer? If you just have regular Medicare and that's all you have, well, Medicare, they don't cover things like your eyes, your ears, or your teeth. So there is no vision, hearing, and dental covered by regular Medicare. So the Advantage plans have come in and they've added benefits that give you some vision coverage, they've added some hearing coverage, and they've added some dental coverage. So that's one of the advantages of being in a plan like that. If you just have regular Medicare, there is no maximum out of pocket that you could spend in Medicare Part A. There is no maximum out of pocket you could incur in Medicare Part B. When you go into the Advantage plan, all of the Advantage plans are required to put a cap, a maximum out of pocket cost for you each year. Most times in order to hit that maximum out of pocket cost, it's going to require either severe illness, possibly be on some severe drugs like kidney dialysis or chemotherapy, or multiple stays in a hospital. Okay? It's really hard to hit some of these maximum out of pocket. But you do want to look at what is my worst case scenario when I go into a Medicare Advantage plan. Because unlike regular Medicare that has no limits, these Medicare Advantage plans will put a maximum out of pocket for you. It's good to live in the Dallas-Fort Worth area because we're in a very, very competitive marketplace. We've had a lot of competition and the Advantage plans have gotten very, very benefit rich this year. For 2021, the Advantage plans have added, for 2021, these Advantage plans have added things like acupuncture, chiropractic care, dental. We've seen dental now expand $3,000, $4,000. Dental used to be not covered at all. Maybe then you got cleanings done. There are some plans out there that will actually give you implant coverage. Unheard of a couple years ago, but now you can there's some plans out there that actually cover implants. So when you're shopping for the Medicare Advantage plans, look to see what benefits are best for you. Some's got transportation in there. So the key on here is what is important to me when I'm looking for my medical coverage. Because each one of us, okay, our health is a little bit different, our finances are a little bit different, and how we view insurance really is a little bit different. So when you're out there comparing Medicare coverages, ask yourself, what's the most important thing to me? What's the most important thing to me? Here's a kind of a slide that tells you what the do's and don'ts are when you're coming into Medicare. If I know that I'm going to sign up for Medicare, let's say in 2022, couple things I want to make sure I don't do. Don't take any distributions out of your retirement account. If you take a distribution out of your retirement account, that's going to be ordinary income, and that's going to artificially inflate your earnings. And remember I told you back in the beginning, your Medicare Part B premium is based on your earnings 2 years prior to you enrolling. So you don't want to do anything that would artificially increase your earnings there. You also don't want to delay signing up for your Medicare Part A and or Part B, especially when you lose your group coverage. You want to make sure that you're in there. The other thing you don't want to do is don't just assume the big name is the best coverage for me. You want to take a look to see what coverage is out there for me. I always recommend people to talk to a broker. Talk to somebody that represents multiple plans. If I only represent one plan, then you know what's going to be best for you, that one plan. Or there's brokers out there that represent multiple plans out there, and they can go ahead and give you a true, unbiased recommendation of which plan is best for you. So I always recommend to talk to somebody that doesn't have any biases when they're making their recommendations for you. It's good to be living in the Dallas-Fort Worth area, because even though Medicare costs are itching up each year, because of the competitiveness of the Advantage Plan world, your actually Medicare costs can actually be going down. This year, due to some legislative needs and competitive needs, we're seeing insulin costs are dropping. We're also seeing the cost for COPD drugs dropping dramatically. We're having more coverages inside that donut hole are going to be covered by some of these by some of the Advantage plans. And manufacturers' discounts are getting a little bit deeper in those. So depending on your health, your Medicare costs in 2021 could actually decrease as opposed to increasing. Okay. I'm Thom Vance. We're with Vance Senior Options. If you go to our website, AdvancedSeniorOptions.com, we have a couple of free ebooks if you're interested. We have a free ebook on Medicare, giving you the Medicare basics. We also have an ebook on Social Security. This will talk about the difference of when to enroll in Social Security, what to expect if you enroll early, the different types of increases you have, what widower benefits are available. We talk about the basics of Social Security on there and how Social Security and Medicare works. So at our website, AdvancedSeniorOptions.com, we offer a couple different free ebooks for you to help you give you the knowledge. We believe that knowledge is power. The more knowledge you have, the better informed you are, the better decisions that you can make. Again, I'm Thom Vance with Vance Senior Options. Our phone number down at the end of the screen here, 682-292-9222. Feel free to give us a call. We'd love to help you. I hope you found this very informative. I want to thank Care and Empowering Seniors for such a great educational event out there. I hope you've enjoyed the presentation. Enjoy the rest of the shows.